we were talking about in the last segment about sickle cell disease, some of the general statistics. Let's delve into complications of sickle cell disease. What are they?
There are many complications of sickle cell disease, as you can imagine, because this is a disorder that affects the blood cells in the body. So the complications can be divided into two to make for easy understanding. We have the acute complications and long-term complications. The acute complications are those that occur suddenly in the child, and some of them can actually be life-threatening. I'll give a few examples. Infections in children with sickle cell disease can lead to rapid breakdown of the red blood cells of the children, and this causes sudden anemia, severe anemia, or shortage of blood, as we say. And these children would require to have a lot of treatments, including blood transfusions. They can also have pain, like we talked about earlier. Sudden occurrence of pain all over the body in the children. And in fact, the women with sickle cell disease that have had babies say that the pain of sickle cell disease is more painful than labor pains.
Wow.
Now, saying this to a man may not mean much, but I'm sure the majority of women listening would understand this.
Well, I've heard it's the most painful experience known to man.
Yes, it is.
So
you can imagine how painful severe crisis in sickle cell disease can be. Other complications that we can have that are acute complications, we've talked about infection, pain, shortage of blood. We can have other acute complications that could affect the bones, for example. So we have the children limping on one leg, having severe pain in one part of the body, and then we could also have acute complications affecting the brain. Now, the long-term complications are those in which the organs of the body get damaged because of the sickle cell disease, and these can occur in any organ of the body. In fact, sickle cell disease is one of the commonest reasons why adults in Nigeria are on chronic dialysis from kidney failure, because sickle cell disease affects the kidneys and may lead to kidney failure eventually. You can have it affecting the heart and leading on to heart disease, could affect the lungs, could affect the vertebral column, could affect any part of the body, the bones, all parts of the body. So those are the acute and long-term complications of sickle cell disease that we can have.
Well, that's a lot. How does that affect the quality of life? I know you mentioned something about the brain.
Yes, I did. Well, I'm glad you asked that question, because that's not an often mentioned complication of sickle cell disease. The quality of life of a child with sickle cell disease is affected. If the child continues to have pain, requires admission for blood transfusion, cannot play with his friends, cannot play football, for example. Imagine growing up as a child, you cannot play football.
Right.
That is not going to be a very happy child. And one of the other things that affects the quality of life of a child with sickle cell disease is when the child has a stroke. Yes, strokes do happen in children, and sickle cell disease is the commonest cause of stroke in a child.
Oh, I see.
We see strokes happening in children with sickle cell disease, and this affects the quality of life of the child because of the complications that can happen from the stroke in the child.
Right. So that's tragic. If you think about it, because when we think about strokes, we think more in terms of hypertension, diabetes, all these things happening to older people.
Yes.
Right, older people as in 50s and above. But when you talk about a child having a stroke, you're talking about at what age can a child have a stroke?
We're talking about children as young as 4 years old, 5 years old, 6 years old.
Oh my goodness.
They can have strokes, and they do have strokes. We have a lot of such children in Nigeria that have had strokes. This is because in the sickle cell clinic that we run, we see these children, and it's the same all over the country.
Okay.
The children are apparently well the night before, because it doesn't give warning signs like you would say.
Right.
They're apparently well the night before they go to bed, and by the morning, they have a stroke. It's as tragic as that. And of course it affects, because it's something that affects the brain of a growing child, it prevents that child from ever attaining his maximum potential in life. It's as bad as that. The child is going to be, some children are lucky. After having a stroke, they don't have many complications. Other children are not so lucky. After having a stroke, they may go on to have difficulty walking, difficulty speaking. Some are even wheelchair bound. They cannot walk. Some cannot attend regular schools, and those that attend regular schools may not be able to catch up with their peers and compete favorably with their peers. Some may even have convulsions, seizure disorders, because of the strokes that they have had. So all of these things tend to affect the quality of life of a child that has had a stroke, in addition to sickle cell disease.
And you mentioned too, I remember when we were talking earlier, that if you've had a stroke, one stroke, it predisposes you to repeated strokes.
Yes, it does. There's a 50% chance that there would be another stroke once a child has had a stroke. It is as high as that.
Oh my goodness.
Once a child has had a stroke, everybody has to be on the alert to try and make sure that that child does not have another stroke, because the chances are very high that the child is going to have a repeat stroke.
So it all comes back to prevention and hopefully treatment that we'll probably talk about in the next segment, right?
Yes.